My name is Shay Reitler, and this will be my video on initiating an IV infusion. So before I even start, I'm going to wash my hands, and I'm going to go into the med room. I'm going to check my MAR, which I've printed here, and I'm going to see what I need. So for this, I'm going to check my, make sure I have my right patient, make sure I'm checking allergies, checking the order, making sure it's appropriate. And it looks like we are admitting for rehydration and antibiotic therapy. For this video, I will just be initiating the IV 0.9% normal saline, 1,000 milliliters to infuse over 6 hours. And so when I go in, I want to make sure I'm doing my checks. So you want to check, make sure you have the right medication before you pull it out, when you pull it out, and again at the bedside before you administer it. And make sure you're doing the right patient, right medication, right route, right dose, right time, and right documentation when you're finished. So I'm looking for normal saline, 1,000 milliliters. And here I have my 0.9% normal saline, 1,000 milliliters. It expires in September of 2020, so it's still okay. I don't see anything wrong with the fluid, and it looks good. So I just did my second check. So I'll take this. I want to make sure I have the correct tubing. I'm also collecting other things I need, like tape, my tourniquet, my flush, and I need to collect the correct needle and gauge size. So for my patient, it is an adult. So typically for an adult, it's an 18, 20, or 22 gauge. For other things, when they need it bigger, they use 16 gauge for like surgeries and such. Pediatrics usually use about a 24 gauge since it is the smallest. And I have a 20 gauge today that I'll be using. I have my saline lock, alcohol pads, cotton swab, or gauze, and then my saline dressing. Making sure I have gloves, everything I need. And then when I leave the med room, just making sure I have that correct medication. I'm going to the correct patient's room and I have all the supplies needed so I don't have to go back and forth. Then when I enter my patient's room, I'm gonna wash my hands, introduce myself, explain the procedure. And for this procedure, you wanna ask if they'd have an IV before, what is their knowledge about IVs? Explain to them what you can about IVs before you get started. So I would want to explain that, the physician ordered that we need to rehydrate you. So I have to infuse normal saline, which is just helps with rehydration in the body. Just making sure when I insert the IV, I'm letting them know what I'm doing, and even step by step, letting them know what you're doing. And I'm going to check my patient's name and birth date before I get started. And now that I'm back at the bedside here, I'm going to do my third check and just make sure I do have my 0.9% normal saline, and I do, so I'm good. So I just checked the allergies and patient name and date of birth. So first, I'm going to start by opening my supplies. We'll start, move things around here. So first I'm going to open my tubing. Making sure I have the correct one. I'm going to make sure and close that clamp right away. And I'm going to label my tubing. I don't have a tubing label, but I'm going to improvise with my tape. And I'm going to put the date, the time, and my initials. Okay. And then I'm going to open my patient package here. And then before I even open this, I'm going to label my, let's see, I'll label it right up here. And I want to put my patient's name, which is IV needed, the date, my initials, and the time. Okay, so now I have my label on here, and I have my label on my tubing. An important part when opening your IV bag and spiking it is you want to maintain sterility with your spike. I got this here. I'm going to remove this. Set this here. Just making sure you don't touch anything to the spike. I'm just going to insert. And once you got it in, you can hang it. And I am improvising with my ski and hanger. So it's not as high, I apologize. So I got it hung. And I'm gonna fill my chamber about halfway. And then I'm just going to prime my tubing. So I'm going to slowly release the clamp, and I'm going to let the fluid flow all the way down to the bottom here. Slowly, we don't want any air or any occlusion. My fluid is running out. And flipping those ports upside down so you're not getting any air caught in there. We'll take it to the end there and go ahead and re-clamp. And I'll save this for when we're ready. Get my supplies out of the way here. And then again, before I get anything else started, you want to create a time label for your IV solution. So I did my math here. So we have 1,000 milliliters to infuse over 6 hours. So for milliliters per hour, it's 167 milliliters per hour. And for drops per minute, it's 28 drops per minute. So on here, I want to put my infusion solution. So we want 1,000 ml to infuse over 6 hours. And I'm gonna put, you're gonna put your start time. And we'll say it's 8 a.m. So about every hour we're having 167 milliliters. So on the bag, starting here, so if I have this up here, I would have my start time, and then at every increment of about 167 milliliters an hour, I would want to put the time that it should be there. So I'm gonna hook this on tape this on my bag. And this will go all the way till the time you finish. So if I started it at 8, I'm going to go down about 167 milliliters. So 100, and we'll put 9 o'clock, because at 9 o'clock we should be there. Then you're going to go about another 100. That would be 10 a.m. And about another 11. Another 167. Noon. Another 167. 1 o'clock. And then by my end time should be 2 o'clock if it's infusing over 6 hours, and I start at 8. So as you can see there, I got every increment, start time, end time, and then where it should be hourly. So next I'm gonna, going to prep my patient. Maybe. Okay, next I'm going to prep my patient. And I know I did, but just making sure you got that name, date of birth, and allergies, which he's allergic to penicillin and latex, so I don't have to worry about anything I have. And just before you even open anything, you're just gonna start by, I'm gonna wash my hands before I touch the patient, and then you're gonna put on your tourniquet. I know, I apologize, my orange isn't as realistic. You're gonna wanna go about 6 to 8 inches above where you are going to inject. So usually about like right up here. And when you're looking for a vein, you're looking for somewhere where there's less hair. If there is hair, don't shave it. That could be a more cause for infection. You're just gonna wanna trim the hair. You're looking to stay, you know, here on the hand, looking for veins here, even right here. And when picking a vein, or before picking your vein, even ask your patient, do you have a preference which arm I poke? You know, they may have better luck on one side than the other with, maybe they've had their blood drawn or something else before, and they never have luck on this arm, but they have luck on their right arm. So I know they appreciate that, and I appreciate that when I go to the doctor and they ask me. So after you figured out which arm you're using, you want to find a vein, you're going to palpate, and you're just making sure it's rebounding. Of course, I would have my tourniquet on. If there is no rebound, or it's a little hard to find the veins, you can try having them pump their fists. You can apply some heat or even stroke the extremity. But once you found an area you want to use, you can go ahead and loosen that tourniquet. So let's take mine off. I'm going to wash my hands. I'm just going to put my gloves on. And I'm going to get all my supplies ready. So I'm going to need a 5 ml saline flush. You want to open your needle and making sure I have that right size. So I have a 20 gauge. Open that. Try not to touch the inside. Just going to get everything open so when I get there, I'm just ready to go. Saline lock. Some alcohol swipes. My dressing. Oops. And then I'll need a couple pieces of gauze. Oops. And I would get a new piece, but I'm just going to pretend that did not happen. I'm gonna open my other piece. Okay, and then you want to get your tape ready. So you're going to need to do a chevron piece on your hub. So we'll get that ready, and that you just need a little smaller piece. And then another piece to go over. So we'll keep that. Okay, so when I'm ready to begin, I'm going to go ahead and put that tourniquet on. And let the patient know what you're doing. So I'm putting your tourniquet on, getting ready. Oops. It's a little harder to tie on an orange. Okay, so I got my tourniquet on 6 to 8 inches above where I'm going to stick. I'm just going to wipe down that area good in a circular motion. And without air drying it or anything like that, you're just going to let it dry on its own. And then as soon as you're ready, take your needle out. Okay, I'm going to open my top. Making sure my bevel is up. Then just placing my fingers here and then my forefinger on my catheter. You're going to want to go no more than 30 degrees, usually about 5 to 15. And when you're ready, I'm going to let the patient know, okay, I'm getting ready to poke. Or here I'm going to poke. So I'm just going to insert my needle and you're just going to go right on top of that vein. And insert. And then once you start to get some blood back, oh, and before I do that, I would be holding my skin taut so I have better control when I'm putting my IV in. So after that, I got my hand up here, my non-dominant hand up here, and my dominant hand down here. Once I get that blood back, you don't want to push the needle all the way in, but you are going to push the catheter in some more. And then just hold that, take off your tourniquet or loosen it, get that catheter in, secure this, and remove that needle. And I put my safety on. And then while I've got this secured, there may be some blood coming out, and if I do, I'll just wipe it with an alcohol swab. But I want to make sure and get this saline lock on. Okay, and once I have my saline lock secured, I'm going to take my tape and do my chevron. Oops. Getting it up there as close as I can. And when I brought that needle down, making sure it's close to the skin. You don't want to leave it standing up. Okay, so I got my chevron on. Just making sure that this is secure. And then I can put one over the top. Now that I'm secure, I'm just gonna do my saline flush. Okay, and we're gonna do 5 milliliters, and just no need to rush. Make sure you're going kind of slow. So I got my 5 milliliters in. Okay. Place this under my hub here. Throw some things away so you can see what I'm doing. Okay, and then you're gonna put your IV dressing on. And I went a step ahead of myself. Before I put it on, I should have wrote on it. But you're just going to put the date, your initials, and the gauge. So I had a 20 gauge needle. Okay, and once I got everything secure, I kind of clean up a little bit, throw away. Take off my gloves. I'm going to wash my hands, put the needle in sharps, and then we can hook up our IV solution. Okay, and where did it go? So you're going to take an alcohol swab and rub the port. And then I am going to open this. And I'm going to insert it to my IV here. And just making sure, you know, it's not leaking. You got this untied all the way. So we got this all hooked up. So now I can undo my roller clamp. And you'll notice it'll drip in here as it's going. And again, the drip for this was about 28 drops a minute. So once you got your solution infusing, when you're doing your rounds and you're monitoring your patient, just make sure you do, make sure when you come in, you're checking the solution, you're checking the IV site, you're looking for infiltration, phlebitis, and any blood that may be present or bleeding. And make sure you're asking your patient too, are you experiencing any pain there? Look for swelling. And then you want to educate them too, because you don't want to have to keep putting new IVs in. So you want to let them know, you know, try to keep it dry. Don't pull at it. Let me know if something's wrong with it and I will come and take a look or fix it. So you don't have to hopefully insert a couple new ones if something were to happen to this one. And then again on your round, you know, you're checking your time label. Is it at 10 o'clock? Is it here? At 11 o'clock, is it here? Is it infusing correctly? Is it infusing slowly? Is it infusing too fast? Just making sure you're keeping on top of it so you're protecting your patient. And then just before you leave your patient, you know, making sure they're comfortable, they got their call light, all safety checks have been done. But then, yeah, just making sure you're doing that hourly rounding on your IV and your patient especially too.